Yali Madad, everyone. It's great to be here with you. Looking forward to spending some time together this evening to talk about a topic that's really close to my heart, how to help you and your family and loved ones afford your medications. Um, so today we will be going over a few things. One is we'll first start with just a brief overview of why prescription drugs are priced the way they are and why they're expensive in the United States. Then for the bulk of the webinar today, we will walk through a few different case studies to illustrate 6 different strategies that you and your family can use with your medical provider to help potentially lower your prescription drug costs. And we'll have time for Q&A at the end, but please feel free to ask your questions in the chat as well. And I will try my best to monitor that as well and try to answer as many as I can as we go through the webinar. This is really meant to be interactive, an interactive webinar, especially with the case studies. So I'd encourage you to try to think about what you might do if you were in that situation, or maybe you have been in this situation before. And so this is kind of how we'll be setting up the webinar today. Just as we get started, I just wanted to share that what we share today are my personal views and that I'm not providing any official medical advice. And I do strongly recommend that as you or your family or others choose to potentially utilize one of these tools that we'll cover today, that you should please consult with your medical provider. He or she can help you to navigate the system, and you'll see where there are very clear roles for your doctor or your medical provider to play in this process. So as we get started, we're going to start off with a Zoom poll. So it's time to vote so we can learn a little bit more about you and what brings you here today. And so we can help tailor this webinar to meet your needs and share some useful information. Great, I think everyone should see the results briefly here. Why folks are here. So it looks like most people are here today because they're curious about the topic. A few of them work in healthcare. They're interested in helping their patients, and a few people are here to help themselves or someone they love, which is fantastic. So really excited to share these 6 strategies with you all tonight. And looks like we have a range of insurance coverage for the Jamaat joining today, but mostly private insurance. All right. So we'll get started with the first part of the webinar, which is a brief overview of prescription drug costs and pricing in the US. So here's some quick facts that are probably useful to know. We spend about $700 billion in the US on prescription drugs. That was in 2023. And it's about 1 in 6 or 1 in 7 of every dollar spent in the US on healthcare. We also spend the most individually, about $1,200 per person per year than any other country in the US in the world when it comes to prescription drugs. And prices in the US are about 3 times higher than in other countries. And when we think about prescription drugs, it's helpful to think about the 2 main different types of drugs, brand name drugs and generic drugs. And this pie chart graph helps to illustrate a really important concept, which is that if you look on the left, you'll see that most of it is orange. And so that's the generic drugs. 90% of prescriptions that are picked up at the pharmacy, so 9 out of 10 are generic drugs. And then when you look on the right, those only account for about 20% of the overall spending. And that small blue triangle that you see on the left, these are the brand name drugs. They're only 1 in 10 prescriptions. But notice on the right, they make up the vast majority of the spending, so 80% of the spending. And this is probably what you or your loved one or your patients may be struggling with, are these brand name drugs. However, there's also people who do struggle to afford their generic drugs for a variety of reasons. And today we will discuss 6 strategies, some of which can help specifically for generic drugs and others that help specifically for brand name drugs. So we'll get to that shortly. High drug prices have consequences. And we always say, a drug doesn't work if a patient can't afford it. And so about 6 in 10 Americans, adults, take at least 1 prescription drug. About 1 in 3 Americans have trouble affording their medications. And that leads them to skip their medications, ration their medications, and look to other more affordable options like over-the-counter drugs. The reason I got so interested in this topic many years ago was because I was seeing the negative impact that high drug prices was having on my patients, on people that I loved. And I just couldn't get over how they used to come to the emergency room, to the clinics, for complications. And it was really, really heartbreaking and sad to see that this was all because they could not either access their drug, they could not afford their drug, or there was some issue related to cost with their prescription drug. So this kind of just walks you through what I discussed, but high drug prices lead to higher costs for patients. That leads to less use of medicines, and that leads to worse health. Just a simple, slightly oversimplified schematic. And the reason we asked the insurance question today about what your insurance coverage is because the tools that we can use to help lower drug prices and drug costs for you and your patients and your loved ones, they vary a little bit based on which type of insurance you have. So you can see that in the US, about half of all Americans have insurance through their job. And then we call this employer-sponsored insurance. So if you're working and your job provides you insurance, you'll have that, and that's usually a type of private insurance. And then about 1 in 5 people have either Medicaid or CHIP. So this is often for low-income Jamaati members, family members, and children who are also part of the household but don't qualify for Medicaid. And you can see the other big group here is Medicare. So about 1 in 7 Americans have Medicare. And then there's a few additional insurances as well, including that about 1 in 11 people remain uninsured. So why are prescription drugs so expensive in the US? And there are 4 reasons why. We're not going to get into the specifics today, but I just wanted to share them with you so that you have a little bit of an understanding about why this is happening, because I think it's a very natural thing to wonder. Like why are these drugs so expensive? And so here's the 4 reasons. The first is that the US offers monopolies to drug companies to sell their drugs at the price that they would like. There's lots of negotiations that happen here and there, but the US doesn't negotiate prices for the entire country all at once. So we don't use all of our bargaining power as a country of 330 plus million people. Recently, Medicare did start to negotiate drug prices. You may have heard of that in the news, and that's a very exciting and promising development. It only applies to Medicare, and it only applies to 10 drugs that they have selected based on the Inflation Reduction Act that was passed in 2022. And there's 2 other reasons why drug prices are high. One of them is that drug companies utilize behaviors that are in their benefit, but against bringing in competition, against other drug companies coming to the market to lower prices. And they abuse patents in order to allow them to price drugs at a high level and keep that price at a high level. Most of these things are illegal, but they still lead to really high prices. Some of the things are actually illegal. And then finally, there's a lot of hidden costs in the supply chain. And you may have heard about the Mark Cuban Cost Plus Drug Company, and that's helped to sort of elucidate some of these hidden costs. And we'll talk a little bit about that later. So today's presentation will have a few different schematics and a few different frameworks that you can use to understand how to understand this really complicated issue. So what can I do if my medicine costs too much? And we will come back to this over and over through our case studies today. The first thing to know is, what is your health insurance? Second is, which type of drug are you trying to access that is unaffordable? Is it a brand name drug or is it a generic drug? And finally, what is your personal situation that you're dealing with? And some of that personalized context can help us to find the best strategy to help you navigate the high drug prices. So here I kind of have laid out the options. And you will see that we'll walk, for every case study that we do, we will walk through these 3 steps. And I encourage you to think about it this way for yourself, for people you're trying to help. because I think it simplifies this complex problem in a way that it can be understood. All right, so we're just about to get started with the case studies. Before we do, I'm going to share the 6 different tools and strategies that are out there that we'll be talking about today in some form. So co-payment cards, pharmacy coupons, patient assistance programs, direct-to-consumer pharmacies, international online pharmacies, and public assistance programs. So you may have heard of some of these, and we'll have a chance to learn more about how each of them works and how to utilize it yourself or for others. So, and if you're going to take a screenshot, there will be an opportunity at the very end to take a summary, take a screenshot of a summary slide. But this is also a really good slide to have for the future. This is a framework, a process for how to approach unaffordable drugs. And we will go through this framework together today. So I'll give you a quick second here, and we will come back to this at the very end as well. So no worries if you're not in a place to be able to take a quick screenshot. Okay, so we're on to scenario 1. And as I said, for those who joined a little bit late, this is intended to be interactive and for us to have some fun trying to figure out how to deal with these scenarios. And so I encourage you to share your ideas in the chat. And also, if you feel inclined, please raise your hand, and I'm happy to hear your thoughts on this scenario. So here's the scenario. There's an auntie who has diabetes. She's taking metformin, but her blood sugar remains really high. Her doctor prescribes this drug called empagliflozin or Jardiance. And the cost at the pharmacy for her for a 1-month supply is $500. So we go back to our process. So this auntie is uninsured. She's interested in trying to get this brand name drug, Jardiance. And this is her first time taking the medication. So we'll go back to our process. So what do we do in this situation? So we start at the beginning. So the first question is she eligible for Medicaid? All right, so as a reminder, the Medicaid program, it's a government-sponsored health insurance program for low-income adults and children, and the eligibility requirements vary by state. You can apply online, you can also apply in person. And there is a preferred drug list for every Medicaid program that is available online based on your state. The great thing about Medicaid, if you are eligible, and this is based on your income first, and as we know, some states have expanded Medicaid, some have not. So it really does vary significantly by the state. I'm in Massachusetts. We have expanded Medicaid. We sort of had a different program earlier, and so there's very generous coverage through this program. And regardless of which state you're in, all drugs that are covered by Medicaid will be $8 or less. And that is a federal requirement. So it's very affordable. Often the drugs are even cheaper than that. They range from $0 to $4. And it's an excellent option an excellent option if you qualify. So check the chat here to see if there was any quick thoughts from any in the audience. But the big takeaway from this case study is always check if you or your family member qualify for Medicaid first. It's a great way to access medicines at a very low cost. All right, I will pause here just briefly to see if we have any quick questions. Otherwise, we can keep going to the next case study, the next scenario. I do see a question.
Nothing.
Yes, uninsured people can get Medicaid if they qualify. If they were uninsured to begin with, that may not be an option. So we will go through the next sort of scenario, and you'll see we'll see some other ways. If the person doesn't qualify for Medicaid, there will be other options. So here's a question. What if she's taking private insurance and the copay is still high? Yes, that is correct. So we will get to a scenario shortly where we have this option. So here we go. Scenario number 2. Same auntie, she has diabetes. Her doctor prescribes empagliflozin, Jardiance. The cost is $500, but she doesn't qualify for Medicaid. So what do we do? She's uninsured. She doesn't qualify for Medicaid. This is a little different than the scenario that was shared in the chat, which we will get to in a second. And she needs a brand name drug. All right, so we go back to our flow chart. So she's not eligible for Medicaid. She needs a brand name drug. So it's the top set here. And what are our options? So we have 3 options here. And the one that applies specifically to her, in this case, the first one we're going to talk about is the patient assistance program. So this is the one in purple. So patient assistance programs, these are programs that are offered by drug companies and nonprofit organizations, many of which are funded by drug companies, and they provide brand name drugs to patients for free or at very low cost. On the right, you see 2 different websites that can help you to access these, to learn more about patient assistance programs. These are Needy Meds and RX Assist. So if you Google needymeds.com, I think it's needymeds.com or needymeds.org, and then rxassist.com, you can type in the name of the drug and you can navigate yourself to seeing more. And we will do an example here in just a second. The patient assistance programs, the thing to know about them is the application process can be time consuming. It does require a signature, typically from your medical provider, and it also requires a proof of income. It is available to everyone, regardless of whether you have insurance or not. And typically the medication, if you're approved, is mailed directly to either you, a local pharmacy, or to your doctor's office every month. And then on the right here, you see 2 of the nonprofit organizations, foundations that are popular and also offer their own patient assistance programs. They all have different requirements slightly, and once they run out of funding per year, they sort of don't offer them as any longer. So it is important to, if you pursue this route, to really see if funding is available. But PAN Foundation and HealthWell Foundation are 2 of the largest nonprofit organizations that have patient assistance programs. So we'll do an example here using the first resource, Needy Meds, and how to go about this in this scenario for the auntie that has doesn't qualify for Medicaid. She doesn't have health insurance. So if you type in Jardiance on the Needy Meds website, you'll see the drug pops up, the name pops up at the bottom, and you have 3 options here. And this pill with a clock corresponds, as we can see here, to the patient assistance program. So you click on that link, and then it gives you 3 different programs that are patient assistance programs. So as you can see, 2 of them at the bottom are the ones that we talked about briefly, the HealthWell Foundation and Patient Access Foundation. And typically, though, you want to try to apply through the drug company first. The other programs will require you usually to apply to the drug company first. So in this case, drug company's name is listed here and their program is listed there, and you can click on that link and it will take you to this page. And it's important to read the eligibility criteria and to understand who qualifies. So in this case, the company's website tells us that they have a few criteria here. You must have a physical address in the US. You must have 0 health coverage or not enough coverage to obtain the medication. And you must meet a few of their criteria, their income criteria. And it tells you what you need to provide in order to be able to apply for this program. So it gives you you have to complete these sections. You have to have your doctor or medical provider sign section 5 and 6, and you have to provide proof of income. And then when you look further into it, it tells you about the income eligibility. So in this case, these are the income requirements. So for a household of four, um, if assuming that you live in the Northeast and not in Alaska or Hawaii, the cutoff limit for eligibility is $75,000. And this can change every year. So this is for 2024. So if you make less than that annual household income before taxes, you could qualify for this program. So takeaway number two for this scenario is that patient assistance programs are available for some brand name drugs, but be prepared to complete paperwork and show proof of income and wait for processing. And it really depends on the situation, how long this takes, but typically it can take anywhere from 2 weeks to 8 weeks for you to hear back about whether you have submitted the paperwork. Sometimes it can be a little bit faster, but usually for everything to be processed, it takes at least a few weeks. Yeah, great question here in the chat. What if the auntie still does not qualify? Fantastic. Suleiman, you're helping me with this webinar tremendously. And I promise we did not talk about this in advance. So we will continue to the next scenario because sometimes people do not qualify for these programs. And as frustrating as it is, if you know you don't qualify based on the income, then please save yourself the time. Don't apply, and look for a different option on this here. Okay, so we'll move on to scenario number 3. And again, this builds off of the last scenario. So, but it's a little bit different. So in this situation, same auntie, she has diabetes. This time she has Medicare. So, before she was uninsured, she has Medicare. She gets the same drug, Jardiance. The cost is still about the same, $500. She doesn't qualify for Medicaid or qualify for this patient assistance program. So she's not qualifying for that. And so we go back to our flow diagram. And so it's Medicare, insurance, brand name drug, and we know that she doesn't qualify. So what do we do now? So we'll go back to our schematic, our framework process here. So we tried the first option. It didn't work, right? Well, the first option doesn't apply to her. It's private insurance only, the co-payment card. We'll talk about that in a second. But for her, we tried the patient assistance program, and that didn't work. So that leaves one additional option, which is like a last resort option for a brand name drug, which is the online international pharmacy. Okay, so let's learn about that. So online international pharmacies are pharmacies that they sell and ship prescription drugs directly to patients. You don't need health insurance, and they don't accept health insurance either because it's, the health insurance applies in the US. So you must purchase the drug for yourself, and there is a maximum of a 90-day supply that you can purchase. And this is really important because these international online pharmacies there are some rules around this from the Food and Drug Administration, or the FDA, which is the government body that ensures that drugs are safe and effective for drugs in the US. For drugs that are international, and if you're purchasing for yourself, it's required that you only purchase 90 days maximum supply. And you shouldn't be purchasing for anyone else. Of course, you'll need the help of your doctor or medical provider with this. And so it is recommended that you work with your medical provider if you choose to pursue this option. And also very important in this process is that try to use, and please use a reputable online pharmacy, a trustworthy online pharmacy. Otherwise, you may get a drug that doesn't work or it has low quality. And so we will walk through some tools about how to do that as part of this approach. Okay, so here's our resource. It's called pharmacychecker.com. And now pharmacychecker.com is an independent nonprofit organization, and they verify international online pharmacies. And they allow patients and their family members to compare prices. If you choose to go through this option and find a pharmacy, you or your medical provider will likely need to fax or upload the prescription to the pharmacy, and you will need to then pay for this, and then the drug will be shipped to you if everything gets approved. So the shipping times can vary. They're about 10 to 21 days, depending on which pharmacy you pick and that sort of thing. So on the right-hand side, you can see a picture of what it would look like if you went to pharmacychecker.com and you typed in Jardiance. And you will see that there are a few different options. Now, any pharmacy that has a green check mark, that means that it has been verified to be trustworthy from pharmacychecker.com. And you can click on this I that's next to it right here. And if you click on it, it will explain to you the criteria that they went through to independently verify this. And then they will show you the price here, and then you'll have to compare for yourself the quantity and the cost per tablet. So in general, I recommend sorting by the price per tablet. So because sometimes they have different tablets. In this case, all of them are 90, but you'll see if you use this website for other drugs that if you scroll down, there'll be options for 30 tablets or 60 tablets or something like that. And the prices will vary as well. And now I have used this for a few of my patients. It is really a last resort option, but it can help them significantly, especially if they have Medicare and they don't qualify for any other patient assistance, or if they are uninsured, and again, they don't qualify for any patient assistance. So in this case, that $500 drug that was the cost at the pharmacy. Here, that was $500 for a 30-day supply. This is, depending on which option you pick, about $115 for a 90-day supply. So there's a big difference here, right? Much cheaper and much longer supply. So here's the takeaway from this section. Online international pharmacies are a last resort option for brand name prescription drugs, and use a trustworthy pharmacy. I'm going to pause here for a second. I think there were a few questions in the chat. How reliable is online pharmacy? And can drugs be mailed from outside the US? Yes, that is a great question. So online pharmacies can be reliable, but as is recommended in this presentation, using Pharmacy Checker will help you to find a pharmacy that it's reliable. I typically, when I use this for my patients, I really focus on Canadian pharmacies specifically. I don't necessarily like or trust other pharmacies outside of North America, but you will see there are options from other countries like Turkey and India and others. Oftentimes, it's the exact same drug that's being produced in the exact same manufacturing facility in the same plant. And it's just being shipped to those countries by the drug company. You know, when a drug is brand name, there's only one drug company that can make it. So they make it in the same place typically, and they have a few factories, and then it gets sent to all over the world. So when you're receiving that drug, as long as the country that you're receiving it from has their own safety verification process, like Canada does, like many countries in Europe do, you can be fairly confident that the quality of the drug you're getting is good quality. Now, if you purchase the drug from a country that doesn't have their own FDA, their own Food and Drug Administration type of organization, for example, a country in Africa, we could say, then there's a chance you're going to get a bad or low quality drug. And, we don't recommend that. So again, talk with your medical provider if you have questions to make sure you find the right fit for you. But this is a fairly user-friendly way to learn more about these options. And I have used many of these pharmacies on this page, Canadian RX, 1-800-RX, and my patients have had a good experience with it. But you should really, consult with your doctor, understand your situation, and figure out what is best. And yes, you can still get it from this pharmacy, even if um, can you still, if the prescription is not written in the US, can we get it from an online pharmacy? I'm not sure about that. You would have to double check based on the pharmacy, what kind of prescriptions they accept. But they do verify the prescription. So it has to be a real prescription. So I would double check on that. I'm not 100% sure about that question. All right, so we're gonna move on to the next question, the next scenario. Okay, I'm just gonna stop for a second here and double check this question here from Shiro's. Does Canada need their own prescribes doctor? I think if I'm understanding your question, I think you may be asking that do you need a Canadian doctor to prescribe the prescription, the drug for you if you're buying it from the US? And
That's
for that, at
correct.
least that is you do not need to find a Canadian doctor. You can just use the prescription from your doctor in the US or elsewhere and upload it or fax it, have it sent to them. So they will verify the prescription themselves and they will go through that process, but it doesn't have to be from a Canadian doctor. This is an international online pharmacy. So they ship all around the world and they don't need prescriptions only from Canada. Again, last resort option, but it can be an option for some people. All right. Let's take a short little breather and reset. So now we're going to switch to a slightly different scenario. We'll continue in terms of insurance. So we still have auntie with diabetes, but this time she has private health insurance and it's from her job. And she is prescribed the same drug, Jardiance, and the price at the pharmacy is a little bit less than in the past. It's $200 for 1 month supply. Now remember, it was still cheaper at the international online pharmacy, right? So it's just something to keep in mind. So now what do we do in this situation? So she has private health insurance. She needs a brand name drug, and this is a long-term medicine for her. So we're trying to find a sustainable option that she can get, a consistent price over time for this drug. But she has private insurance, and that's a big differentiator in our process. So we'll go back to our flow diagram, and in this case, we're in the brand name drug section, and in this case, the auntie has private insurance. So she is eligible potentially for a co-payment card, which we did not have that option before. This is a new option because it's only for people with private insurance. So let's talk about that. All right, manufacturer co-payment cards. So what are these cards? So brand name drug companies, they offer these co-payment cards and they provide drugs at a much lower cost for patients at the pharmacy. There's also co-payment cards for drugs that are administered in clinics or in hospitals as well. So like infusion-based drugs or injectable drugs. But for this example, we're talking about a pharmacy-based drug. So now, again, these are only available if you have private insurance. You cannot use the drug if you have public insurance. So public insurance includes Medicaid, Medicare, and also if you're uninsured, this option is not available. It doesn't matter what your income is, you can qualify for this option. And here is the interesting part. So there is a limited benefit every month or every year that is set by the drug company. So it's not as if 100% of the cost is going to be covered. And it's typically only valid for 12 months, but it can be renewed as long as the program is still happening by the drug company. So they have all the control in terms of whether they offer the program, how long they offer the program, and that sort of thing. All right. And sometimes these cards and copayment cards can steer patients to more expensive medicines, even when there is already a lower cost alternative that is just as good. So this is something important to keep in mind. which is that don't get distracted by this copayment card if there is a cheaper drug that's just as good available. This is a tactic that the drug companies use for you to continue to use a brand name drug. And again, work with your doctor and your medical provider to help figure out whether there are other options, other drugs that may be better for you instead of this brand name drug. But let's say we do need this drug. Auntie needs the Jardiance. It's important for her diabetes. We know that that drug helps people to live a little bit longer, and helps control their blood sugar. So we want to try and get it for her. And so this is how do we get the copayment card? So what you do for this is you go to Google and you type in the name of the drug, Jardiance, and you type in copayment card. And when you type in those two things together, you will find a link, and you can click on that link from the drug company, and you'll see this page here. If that doesn't work for you for some reason, you can go back to Needy Meds, like as we had discussed before, and you can click on the copayment card button. So when we use the Needy Meds example, we clicked on the patient assistance program button, but there's also a copayment card button there. And Needy Meds will help direct you to this website. And this is a fairly straightforward process. So it's going to ask you a couple questions. Are you over the age of 18? Do you have commercial or this is private insurance? So we say yes. And it's going to ask you once more just to make sure that you're not covered by Medicare or Medicaid. And then we will say no to that. That's an important question. And then it will walk us through the process for what to do. So you enter your personal information. And once you put in your personal information, you can literally right away print or email the copayment card for yourself, and you can take that to the pharmacy. Now, here's the thing. As I mentioned before, there's a limited amount of coverage per month or per year. So in the case of Jardiance, it says you can pay as low as $10, but they only allow a maximum of $175 in the benefit per month through this copayment card. So that's an important thing that you have to find and be aware of, because in this case, if their cost was $200, it will reduce it down to $25 per month. So again, this is still a really good option, a great option potentially for this auntie. Okay, so our takeaways for copayment cards. Manufacturer copayment cards can lower your out-of-pocket cost for brand name drugs, but only if you have private health insurance. Okay, so I'm going to pause here and take a look at the chat to see if there's any questions. So we have a question, a comment about how sometimes you can use a copayment card and realize that it's actually a higher price than if you did not use insurance. And that can happen. Oftentimes that happens because of the time of the year that you're using the card. So if you haven't used your medical benefits during the year, and let's say you're in January or February and your medical plan is resetting, and for example, you're in a high deductible health plan where you have higher costs out of pocket, you might face a very high bill in the first few months. And then after that, your bill might be very low. It could be once you have met your deductible. So I'm not sure if that's what was happening in your situation, but you are correct that that can happen. And in that case, you have to make the best decision for yourself and work with your medical provider or the pharmacist to help you with that. Is there a catch to using this? No, there is no catch actually to using this if you qualify. It may seem like too good to be true, but the way that it actually works is that the drug company just takes that loss. They just will pay that price, the cost of that amount, and then they will allow your private insurance to pay the rest of the cost of the drug. So the cost may be $200 to you. They will reduce it down to $25. The drug company will take that loss of the 175, and then your private insurance company is still going to pay a few $100s in the back end that we don't ever see to to the drug company. So don't worry, their drug company is not getting $0 or just $25. They are actually making money from your private insurance company. And this is a game. This is, again, is a tactic. It's a strategy that the drug company uses to make this drug cheaper for you or your family member or your patient so that you use the card, so you use that drug. But again, it's a business and they are not taking it for a loss. There's no catch. It's the same drug. It's just that they're trying to make it easier for you to get it. So that's how it works. Okay, so we're going on to scenario number 5. And now we're going to switch up the scenario. And we have an uncle with high blood pressure. He also has high cholesterol and he has erectile dysfunction. He has Medicare and his doctor prescribes this medicine called tadalafil, which is the generic medicine for Cialis. And his cost for this generic drug is $210 at the CVS. And it turns out that the pharmacist tells him that, I'm sorry, uncle, but this drug is not covered by your insurance company. And this is a very common scenario because in general, Medicare does not cover certain drugs for erectile dysfunction. So here we go through our 3 steps process, right? Medicare, this is a generic drug. And here's the important personal context that uncle also has a Costco membership. Okay, so we have spent time talking about the brand name drugs, but now we're going to switch to talking about the generic drugs. Okay, so the top section is no longer relevant for the rest of the presentation. And now we will focus on generic drugs. So we have 2 options here, pharmacy coupon or direct-to-consumer pharmacy. Okay, so let's start with pharmacy coupons. So what is a pharmacy coupon? These are coupons that provide discounts on medicines using local pharmacies without using health insurance. So it's available to all patients, regardless of if you have insurance. And it's good, especially it's good for generic drugs that are either expensive or that are not covered by your insurance. The amount that you pay out of pocket in cash or credit card, debit card, that amount does not count towards your insurance deductible or your insurance maximum for the year. Because remember, you're not using insurance. You're getting this without insurance, paying with the coupon. And it's important to keep in mind that the prices that you can find with these pharmacy coupons, they change frequently, sometimes every day, sometimes every couple days. And it varies by the pharmacy and the zip code that you live in. So if you ever use these tools, you will see that the prices do vary. So we're going to walk through an example using the most popular version of a pharmacy coupon, which is through GoodRx. And for all the healthcare providers who are here, there's also a GoodRx Pro that you can download. I use that app on my phone. It's for medical providers to help their patients. It makes it really easy for you to find a coupon and very simply text it to the patient without using your phone number, but using an anonymous number. And I find it's a very useful tool because you can just, you or even your medical staff, you don't have to do this yourself. Your staff can help find the coupon. They can text it to the patient and they can then show that coupon directly at the pharmacy. So in this case, we'll type in tadalafil, and this is what we will see. So we see that the drug, you can even see it here. The retail price is crossed out. It's like $400 retail. But look at this. We have a few options here in the Boston area for this drug that offer it for much less than the $210. There are some special deals, but there is $2 option. There's $18. There's $11, $3, $13. There's many options. And so the most important thing here is we have to make sure when we are using this application, this program, this website, we have to make sure that the drug name, the dosage, the strength of the drug, and the number of tablets is correct, and that it matches your prescription with that your medical provider is providing you. And then you can review the pharmacies near you, and you can figure out which one you want to use. Oftentimes, my patients will decide based on which is closest to them. That, for example, if you have a CVS nearby, it's $19, $18.58. But maybe the Star Market is a short drive away, and with a special offer, you can get it for $2. So it might be worth it to drive. It may not be worth it, and you might prefer to go to use a different option. Either way, you can decide which option is best for you for this particular drug. Okay, so this is it for the section on pharmacy coupons. I'm going to pause here briefly, and we are going to switch to the next option for generic drugs. And I'll just remind you briefly, there was pharmacy coupons and then direct-to-consumer pharmacies. Okay, so if there's no questions about the pharmacy coupons, let me just check one more time here. Okay. We will move on to direct-to-consumer pharmacies. And as you can remember, in this scenario, we said that the uncle had a Costco membership. So why did we share that information, right? So the reason that that was provided in this case scenario is because Costco has a direct-to-consumer pharmacy. So what is a direct-to-consumer pharmacy? It is a online or in-person pharmacy that sells prescription drugs, again, without using health insurance. It's available to everyone, doesn't matter what your insurance is. And it is also good for drugs that are expensive or not covered by insurance, just like the coupon. This is a similar option. It's just another option. You can pick what is best for you or your patient. So again, the amount that you pay doesn't count towards your insurance. And the interesting part about the direct-to-consumer pharmacies is that some pharmacies may require a membership to a store or the program. Usually it's to the store in order for you to be able to use it. So on the right-hand side, I've listed the most popular, most common direct-to-consumer pharmacies. Walmart and Target are the first ones. They came and started in 2006. They have a $4 drug list. They also have a full pharmacy, but within the pharmacy, they have a direct-to-consumer option, which is, they call it the $4 drug list. So every drug is between $4 and $11, and sometimes they're up to 18 or 20. So it used to be called $4 list, but they're not actually all $4. So you have to check, but that could be an option. Costco, Mark Cuban Cost Plus Drug Company, Amazon Pharmacy, and Health Warehouse. So some of these have the direct-to-consumer option. You can pick it up in person, and some of them are only online. So Health Warehouse and Amazon are only online. The rest have options for in-person. And that could be, depending on your situation, if you need the drug right away, like an antibiotic or something, then you might want to use the in-person option, but just, speak with your medical provider about it. So we're going to use the Costco example to see what to do. All right, so Uncle has Costco membership. We go to the Costco website. It's called the Prescription Drug Program, and it's only for members. So this is what it looks like if you go to the Costco website. For the member prescription drug program, type in tadalafil, we find the strength, we find the quantity, and we type in our zip code, which is not shown here, and it will give you some options. There's even a mail option for them. But here we see that it's $9.99. And so if he's going to be going to Costco anyway, then he can pick it up from there. Now, what about if we used a different pharmacy? What if we use the Mark Cuban Cost Plus Drug Pharmacy? So this is an online pharmacy. They do have some stores in person. They partner with some small independent pharmacies. And they also have a partnership with some, I believe, Kroger's and Tom Thumbs, if I'm not mistaken. But you have to double check that. Let's say we're using the online option. In the online option, we would find the drug. It's $7.70. And look at this, it's 30 count instead of 10. So it's even cheaper than Costco for the amount of pills. And if you add $5 for shipping, they will ship it to you for around $13. And it can take like a week or two to actually get the medicine. So here are my quick facts for the direct-to-consumer pharmacies. I think we've covered most of these, but I will share a few with you. So, the membership piece is an important thing to think about. So, if you already have a Costco or Sam's Club membership, That's good. You know, you can utilize those direct-to-consumer pharmacies. Amazon has a special pharmacy it has special deals for Amazon Prime. So lots of people have Amazon Prime memberships. And if you do, then you can get the really good deals and get good shipping in under 2 days usually. Amazon also has a really interesting program called the RX Pass program. It's actually very good for some people who take certain generic drugs. It's a membership. You spend $5 a month for this membership, and it gives you as many of these 59 drugs as you need based on a prescription from your doctor. Um, and you don't pay anything for the drug. The drug is free. You just pay the $5 per month. So you have to look at the drug list and you have to make sure you're in a state that qualifies, but most states do qualify. But the big takeaway here is that you have to really shop around. It takes a lot of time to figure out which option is the best for you and your patient or your family member. And this is where, like, time is money. This is where the little trap is for this one, is that once you figure out what you're going to use, it can be really easy, but it does take a little bit of time to figure that out, especially if you're using a new pharmacy or a new option that you haven't done before. And then after that, you might be in good shape. And you can get significant savings for some generic drugs using the direct-to-consumer pharmacy option. So here's our takeaway. For both pharmacy coupons and direct-to-consumer pharmacies, they can be very helpful ways to lower your costs for generic drugs. You decide with your medical provider which option is best for you, and then work with them, because you'll need their help to send the prescription to that pharmacy. Or they could print it out for you and you can take it with you. That often is a little bit easier. And yes, there's very, very helpful information in the chat as well. If you take your prescription with you and your coupons with you, the pharmacist and pharmacy staff can be very helpful resources as well. They're there to help you as well. There was one question about injectable drugs. I might wait until we get to the end and just learn a little bit more about that question so I can try to help answer it. I think we're getting close to the end here, actually. This is the slide that I was going to say is a summary slide. So we are at the end of our case studies. We've finished all 5 of them, and we're just wrapping up now. So this is a summary of all the strategies to help that you can use to help afford your medications. So you might want to take a screenshot of this slide to reference in the future. So I'll just wait a few seconds here. Okay. And now we will open the floor for any additional questions. I know we've been taking questions as we go, and we're getting near the end of the webinar as well. So if anyone has any questions, please either raise your hand or put it in the chat. I might ask our Ferial to maybe provide a little bit of more information on if you can come off of mute and share your question about the injectable drug.
It's about Vigovia.
For which drug is it? Wegovy?
Vigovy.
Wegovy. Okay, yes. And what is the question?
And it's not covered by Medicare, and therefore I'm wondering, how can we get it at a reasonable cost? It's like $1,200 to $1,400 per month.
Yes, thank you for that. And you're absolutely right. I'm so sorry. It is a very expensive brand name drug. So if we go back to our pathway, we can walk through the options here. So if you have Medicare, you're right. This is actually a unique situation because Medicare doesn't cover the drug at all.
No,
And
Medicare doesn't cover it either.
that's right. That is correct. And some Medicaid programs do cover it. So if you are eligible for Medicaid, that would be one way to get the drug in your state. If you are not eligible, because Medicare doesn't cover it, then the next option would be to try the patient assistance program. So that's what I would try. And I have applied for this drug for some patients using the patient assistance program for Wegovy. They have you have to check the income limits if you qualify based on how large your family is and whether you can provide the proof for that income. But the first thing I would try is the patient assistance program. So I would go to the
Do
Needy Meds.
qualify by income. The person I'm checking for does qualify for income. The person
Okay.
doesn't want to come on board, so I'm checking for that person. And the
Okay.
person qualifies by income.
Excellent. Okay, so if they qualify, the next step is to fill out the paperwork. And what I would suggest is I can share it with you in the chat. Actually, maybe I can stop sharing my screen just very briefly. But there is the patient assistance program for Wegovy, and it will allow, you'll have to complete the paperwork for that. So here is the or you can apply online. I'm just gonna share quickly in the chat the link for that. Oops, sorry about that.
I'm sorry, I'm not computer literate and I'm in bed very sick, so I can't take the notes. Is it possible for you to email?
Ferial Auntie, I'm gonna send it to you. Don't worry about it. This is Sana.
Okay.
Yeah.
Okay,
I'll
thanks.
send it.
Thank you, Sana. This is what it looks like for the website for anyone who's interested. This is a very common, popular drug these days, but there is a way to apply for the patient assistance program online and also the forms. And so we will follow up with you on
Thanks
that.
a lot.
You're welcome.
Hussain, there's another question which was sent directly to us. I'm just gonna read it out. Hi, we have private insurance and need Rinvoq for rheumatoid arthritis. The copayment itself is in thousands, even though we have already met our copayments for the year. Is it advisable to use the Rinvoq savings card as they claim that the copayment will be $0?
Yes, thank you for that question. Yeah, so Rinvoq is also another common common brand name medication that is very expensive. And yes, you can try to use, if you have private insurance, use the the copayment card. It's probably Rinvoq, because of the way it is. If we Google the copayment card, their terms and conditions are going to be a lot more generous than the example that we had. So if you remember the Jardiance example, it was a maximum of $175 per month. I'm not 100% sure what it is for Rinvoq, but I can follow up with you to help figure that out. Usually for those types of biologic drugs, the amount covered is a lot more, somewhere between 10 and 20, sometimes $30,000 per year. So it may be $0 the first month, but remember, there's a maximum amount that copayment card works for the whole year. So at some point in the future, it may no longer be $0 if you meet your maximum allowed amount. So that's just one thing to be aware of. You may also talk with your doctor about, other options if there are any. It is hard to get injectable drugs from international pharmacy means, and it's not really advisable. So I think the copayment card option could be a good one. I would just check the terms for how long it will be valid. Okay. Okay, great. Thank you all so much for joining today. We're just wrapping up here, so we're going to launch the last closing polls. If you could just take a minute really quick to reply back, this is really helpful information for us. I hope you've had a good webinar. I will share some contact information so that you can reach out to me and the health board team so that we can help you if you have any questions. So please stick around for that.
Hussain, while we're waiting for the poll, there is a question in the chat. What is tier 3 or tier 4 meds?
Sure. Yeah, so tier 3 or 4 refers to how your insurance company places the drug on the list of drugs that they cover. So tier 1 usually are the inexpensive, the low cost generic drugs. Not always. There's some situations where that's not the case, but as you go up on the tier 2, tier 3, tier 4, sometimes there's even a tier 5. The higher the tier, usually the more expensive it is, and that usually translates to higher cost. You should not really be something to worry about typically, in the sense that you will be sort of required to pay the cost based on your insurance plan, your drug insurance benefits. And so I usually the tier is not super important in itself, but it does affect the cost that you pay. Yes, and picking up on the conversation in the chat about this, the specialty pharmacy is a special pharmacy that dispenses those drugs that are tiered on the higher level, usually on the specialty tier or tier 4 or 5. They were sort of started in the previously when it was thought that some drugs require additional care, and so like for example, CVS and Walgreens have a specialty pharmacy, but it's not necessarily that the drug is anything special. Sometimes the insurance company and the people they hire to manage the benefits, they will just put the drug on a specialty tier in order to raise the costs and that sort of thing. So yeah, it's a different pharmacy you and your doctor will have to coordinate with. We will just wrap up here. We did share the health board email in the chat, and I'm also including my email here. So if you have any questions that would be and you would like some additional help, you can email me at my email on the screen, and I will also put the health board email in the chat. So both of our emails are there, so you can copy them. And we're happy to try and help, and hope you enjoyed the webinar.